morning, Chair and committee. Sorry, my voice is gone. Hopefully, I can get through this. Today, I'm here to present SB875. It ain't gonna help. This bill passed out the Senate back in 2023. I did do a committee substitute to change this to a pilot program for St. Louis City and County at the request of the chair, Senator Carter. This act requires that the Department of Social Services to establish a restaurant meals program for St. Louis City and St. Louis County as part of the Supplemental Nutrition Assistance Program. Under the program, households containing certain senior, elderly, disabled, and homeless individuals shall have the option in accordance with federal law to redeem their SNAP benefits at private establishments that contract with the department to offer meals, including hot foods and meals intended for immediate consumption for eligible persons at concessional prices. Hopefully I can. So, this is not a requirement for anyone that is on SNAPs. It's an option. It's also not a requirement for restaurants. They have the option to get in the program or not. Why support this? Supporters argue that this helps people who can't necessarily cook for themselves. For example, someone without a kitchen, someone with mobility issues, or someone who can't prepare meals due to disability. It gives them more flexibility and dignity in using their food benefits. This helps reduce chronic stress. It reduces isolation for seniors. Loneliness is one of the biggest mental health risks for older adults. Being able to leave the house, sit in a restaurant, be around other people, create small but meaningful social interaction. Even brief public engagement can reduce depression, increase sense of belonging, improve overall mood. My mom is a senior and also a disabled person. And just to get out the house helps her with her feeling better about herself. It gives her a sense of being independent. You would think she tends to, even though she's not on SNAP benefits, but she tends to go to restaurants and to pick up a bunch of made food so she can have meals to eat throughout the week. So this is what that helps for them. It preserves dignity for people with disabilities, stability for homeless population, access to predictable hot meals. Nutrition directly impacts brain health. The proper restaurants that can participate as local diners, fast casual restaurants, some fast food locations, as well as cafes that agree to participate. Some people ask if they can go to the restaurant, why can't they cook for themselves? For many seniors, they have arthritis, they have limited grip strength, get fatigued easily, and are at risk for falls. And a lot of them have a hard time standing to be able to cook for themselves, which is a problem for my mom as well, who is a senior and disabled. Walking into a restaurant and sitting down requires far less physical strain. Carrying grocery bags, standing to cook, lifting pots, cleaning dishes. Disabilities are not one size fits all. Be able to leave the house. Someone may be able to leave the house but not be able to stand long enough to cook, or not safely handle knives or hot surfaces, or live in housing without a functional kitchen. Homeless people, unhoused people do not have stoves, a refrigerator, or a sink to store food, or even electricity to cook. This is not about convenience. It's about physical capability, safety, dignity, and reality. We shouldn't design policy based on what we assume people should be able to do. We should design policy around what vulnerable Missourians are realistically able to do. That pretty much concludes mine, and I have some witnesses here. If you do you have any questions?
Thank you, Senator. I'm so sorry for your voice. Hope you get to feeling better really soon. Any questions for the Senator? Seeing none. Anybody here to testify in favor of Senate Bill 875? Sure, come on up. And just begin whenever you're ready. And if you have a witness form, you can just leave it there on the table. And if you don't have a witness form, if you'd please fill one out too. Thank you.
Thank you. Thank you, Mr. Chairman and Committee. John Gaskin, registered lobbyist, here on behalf of the Missouri Community Action Network. Thank you, Senator, for bringing this bill. Happy to be here to testify in favor of this legislation. The Missouri Community Action Network is a statewide association for Missouri's community action agencies across the state of Missouri, ensuring that every county in Missouri is served by an agency dedicated to reducing poverty and strengthening communities. Every county within Missouri is served by one of the state's 19 community action agencies. Through this statewide network, we have firsthand experience working directly with elderly, disabled, and homeless residents who rely on SNAP benefits to meet their basic nutritional needs. This bill actually helps the folks that they serve in ways that individuals experiencing homelessness often lack cooking and food storage facilities. Elderly or disabled individuals may have health limitations, as the Senator just outlined, and current SNAP rules limit recipients to purchasing groceries, which can leave these populations without practical access to nutritious, ready-to-eat meals. Other benefits of the bills include ensures hot, nutritious meals for people who might otherwise skip meals, provides a choice in how people access meals, respecting individual needs and circumstances, and encourages partnerships with local restaurants, which could support small businesses and local economies. This creates a ripple effect economic-wise for food distributors, farmers and vendors, restaurant workers, and service staff. And every dollar spent locally strengthens the community's economic ecosystem. In closing, bringing federal SNAP dollars directly into local restaurants and small businesses, it supports jobs. It supports job stability for the restaurant workers and the businesses itself, and it strengthens local economies through increased consumer spending and community partnerships. Thanks, Mr. Chairman and Committee, for the opportunity to testify.
Well, thank you for your testimony. Appreciate that. Any questions for the witness? Seeing none, thank you, sir, very much. Next, in favor of Senate Bill 875.
Mr. Chairman, members of the committee, my name is Jay Hardenbrook. I'm the Advocacy Director for AARP here in the state of Missouri. We're a social change organization for the 50-plus with a membership of over 750,000 in Missouri alone. We'd like to thank the Senator for once again bringing this legislation forward. Obviously, we have a lot of our older members who, for some reason or another, aren't able to prepare their own meals. Also, this is a good reminder, if you have older or disabled relatives, go have a meal with them. It definitely improves their day. The nice thing about being able to get these prepared meals, as the Senator said, though she was unfortunately losing her voice, that you really can build a community at a lot of these restaurants. We all have older relatives that go to that special cafe where they meet with their friends, etc. I understand the reason for moving it to a pilot program. I hope that it becomes a huge success in the St. Louis Metro and that we're able to spread it to the rest of the state.
Thank you very much for your testimony. Any questions for the witness? Seeing none, thank you very much. Next, in favor of Senate Bill 875.
Good morning, committee.
Good morning.
I'm Amanda Berry. I'm a food security policy manager with Empower Missouri. The bill we're discussing today, as the Senator has stated, asks Missouri to begin an option that exists in the federally funded state-administered SNAP program called the Restaurants Meals Program. The state's optional program would specifically support folks who are already qualified for participating in SNAP. It is not an extension of SNAP, but specifically to populations who are elderly, disabled, or considered homeless. Currently, because of SNAP rules, SNAP recipients can only purchase cold, unprepared food that they have to take home and then prepare. And as has been previously stated, this can really be a challenge. Ideally, this bill will create a program to address these obstacles and allow restaurants who apply, it is my understanding they have to apply to participate, qualify, and then follow specific rules set out by USDA to sell certain hot prepared foods off their menu to those individuals using their SNAP dollars. We do want to reiterate that this is a small program and it will not be in effect at every restaurant or for every person. It would only be available to the restaurants that apply to be part of this program and are approved and monitored. Even though it is small and very specific, if this bill is passed and this program is implemented, we believe it will make a big difference in the lives of those who could access the broadened support. I hope that you will take these reasons into consideration and pass this bill.
Thank you very much for your testimony. Any questions for the witness? Seeing none, thank you very much. Anyone else in favor?
Good morning, Mr. Chairman and
Morning.
committee. My name is Rebecca Nolan. I am the Chief Executive Officer of Aging Best, which is the area agency on aging here in central Missouri, and I'm also representing the Missouri Association of Area Agencies on Aging, which is comprised of all 10 area agencies on aging in the state of Missouri. We would like to lend our support of Senate Bill 875. We have sort of a unique perspective with SNAP benefits. We help people apply for them. We deliver the majority of home-delivered meals throughout the state, and we have a close relationship with many of the senior centers in the state of Missouri. And in talking with my colleagues, I understand that senior centers probably could have applied to accept SNAP benefits over the years, but since we don't charge for our meals, they would have used them just to make voluntary contributions. And it was decided years ago that that wouldn't be a good use of SNAP benefits, so it was just decided that they wouldn't do that. But it's a new day, and new populations are turning 60. Generation X is turning 60 this year, and we're trying to give people more choices and a broader experience. So one of the things that we've done is tried to introduce some new options for seniors and for other people. So two of the most successful things that we've done, number one, intergenerational programming, which has made amazing changes for both children and older people, and carryout, which people had decided years ago was categorically not going to be allowed. People needed to socialize. There was only one way to socialize. They had to go to a senior center. That was the only way to do it. And over the last few years, it's opened up, and people who work or people who just can't or just can't be successful in a senior center are allowed to take a meal home and do it a different way. We're looking at this restaurant voucher the same way. There's not a one-size-fits-all. Everybody has a unique circumstance. This may not be for everybody, but we think for some people, being able to go to a restaurant, not having to cook or not being able to cook or not going to a center is a wonderful option for them. Thank you.
Well, thank you for your testimony. Any questions for the witness? Okay. Seeing none, anybody else here in favor of Senate Bill 875?
How you doing?
Good
morning.
morning.
Do I have to name my name too?
Yes, please.
I'm Pastor Richard Jackson. Certainly we want to thank Senator Angela Mosley for this bill 875 and her passion for persons who are not able to really fix their meals, for those individuals in whom we may not pay attention to, but if we live long enough, we might be those individuals who cannot cook our food, who cannot go where we need to, where we want to go. So I'm for it because they need to have hot meals, and if you can't, everybody wants to have a hot meal at some time or another. Cold cuts are okay, but they just don't do it all the time. All the days of your life, you eat peanut butter and jelly sandwich, and you hope that's going to be all right. But when you have a hot meal, a good hot meal with a good company of people in a restaurant, it does a lot for your self-esteem. And it's not going to hurt the economy because the more individuals are using that SNAP, the more that's going to bring money into that restaurant. And I want to close with this, that 35% of all the SNAP residents in Missouri, 20% of those 35% are elderly people. And so let's just look at the fact that at 20%, at least we can think about making sure that we make that 20% comfortable. You know what I mean? So don't take too long to vote for this program. Amen.
Thank you for your testimony. Any questions for the witness? Seeing none. Sir, where do you pastor?
We pastor the Greece Church, but I'm part of the national ministry.
Okay, all right. Well, thank you for being here. Anybody else in support of Senate Bill 875? Seeing none. Opposition to Senate Bill 875? Seeing none. Anybody here for informational purposes only? Seeing none. Senator, any closing remarks?
Just wanted to point out that this is already a federally funded program, and the benefits are already allocated, and this is already passed in Wisconsin, California, and Illinois. It does not expand eligibility at all, and thank you for taking the time to hear the bill.
Absolutely. Thank you, Senator Mosley. Get well soon, and please keep your distance from me because I do not want to get sick. This concludes the hearing on Senate Bill 875. Next is Senator Hudson with Senate Bill 1075. Senator, whenever you're ready.
All right. Thank you, Mr. Chair, Senator. For the record, my name is Brad Hudson. I represent Missouri's 33rd Senatorial District, which includes the counties of Stone, Taney, Douglas, Ozark, Texas, Howell, and Shannon, otherwise known as God's Country. Senate Bill 1075 establishes the Food is Medicine Act, requiring the Department of Social Services to apply to the Centers for Medicare and Medicaid Services within the Federal Department of Health and Human Services for a Section 1115 demonstration waiver to implement the Food is Medicine program. The program must be designed to improve health outcomes for MoHealthNet participants with nutrition-related chronic diseases through nutrition services. The bill specifies the covered nutrition services under this program and specifies that whenever feasible, the MoHealthNet division within the Department of Social Services must prioritize the inclusion of community-based organizations and local growers to support the purchase of locally grown food. The bill requires the Department of Social Services to promulgate all the necessary rules and regulations for the administration of this bill. Hippocrates said, "Food is medicine." This is not a slogan. It is a public health strategy, an economic opportunity, and a moral imperative. For decades, our healthcare system has been structured around treating illness after it appears. We wait until diabetes has progressed, until hypertension has taken hold, until heart disease has already narrowed arteries. Then we intervene with expensive medications, procedures, and hospitalizations. But what if we shifted our focus upstream? What if we treated food not as an afterthought, but as a foundational tool for preventing and managing disease? Evidence is overwhelming on why the food you eat matters. Diet-related diseases are among the leading cause of death in the United States. Poor nutrition contributes to heart disease, stroke, type 2 diabetes, certain cancers, and obesity. These conditions account for hundreds of billions of dollars in healthcare spending each year. Yet the most powerful intervention we have is also the simplest, improving what people eat. When individuals have access to nutritious foods, fresh produce, whole grains, lean proteins, healthy fats, we see measurable improvements in health outcomes. Blood pressure drops, blood sugar stabilizes, weight decreases, energy increases, medication needs often decline. Food is not just fuel, it is a biological signal that shapes inflammation, metabolism, immunity, and long-term disease risk. A food as medicine strategy is not theoretical. Programs across the country have already shown remarkable results. 16 states have approved or have pending Medicaid demonstrations that provide coverage for food as medicine initiatives, such as medically tailored meals and groceries. These states include California, Colorado, Delaware, Hawaii, Illinois, Maine, Massachusetts, Nevada, the list goes on. These programs really come in three parts: medically tailored meals, produce prescriptions, and nutrition education counseling. For patients with chronic illness, providing meals designed by dietitians has been shown to reduce hospital admissions, improve disease management, lower overall health care costs. When clinicians prescribe fruits and vegetables and patients receive financial support to purchase them, we see better blood sugar control, improved cardiovascular markers, increased food security. Unlike SNAP benefits, these prescriptions are specific and can only be used for produce. When patients receive practical, culturally relevant guidance on how to eat well, they are more likely to maintain healthy habits, reduce reliance on medications, prevent disease progression. These interventions are not only effective, they are cost effective. Every dollar invested in food as medicine programs can return multiple dollars in avoiding medical spending. We cannot expect individuals to make healthy choices if the healthy choice is the hardest one to make. Policy can change that. By integrating nutrition into healthcare through insurance coverage, community partnerships, and support for local agriculture, we can create a system where prevention is prioritized and health is accessible. This is not about telling people what to eat. It's about giving people the tools, access, and support to make choices that lead to longer, healthier lives. So members of this committee, Mr. Chair, we stand at a crossroads. We can continue to treat the symptoms of a broken food system, or we can address the root causes. By embracing the principle that food is medicine, we have the opportunity to reduce disease, lower healthcare costs, strengthen communities, and improve quality of life for millions. This is not just a health initiative, it is an investment in our future, and I'm happy to take any questions if there are any.
Well, thank you, Senator, and I completely agree that food is definitely medicine. Let me just check with the committee and see if they have any questions for you.
Appreciate that, Mr. Chair.
No questions. Seeing none, anybody here in support of Senate Bill 1075?
Mr. Chair, member of the committee, my name is Jay Hardenbrook still, and I'm still with AARP. So many chronic diseases can be managed through just good food choices. I love that the senator is coming up with really creative ideas. This will be a cost savings to the state, and it will improve people's lives and people's health. It's such a great idea. I'm so glad that he sponsored it. I hope that we move it through quickly.
Well, thank you for your testimony. I'm again going to check with the committee. No, there's no questions. Thank you. I appreciate it very much. Anyone else here in support of Senate Bill 1075?
Good morning. Also, still Amanda Berry, Food Security Policy Manager with Empower Missouri. And I'm kind of data oriented, and so I have some stats to back up everything that Senator Hudson was saying. Although I don't have the beautiful quote, but food is medicine is prevention. Prevention costs less than treatment, and helping people access healthy food before illness escalates is one of the most practical ways to contain healthcare costs. From a budget perspective, it matters because chronic disease related to inadequate nutrition is a primary driver of healthcare spending, particularly in Medicaid populations. National evidence has shown that medically tailored meals specifically can lead to a 70% decrease in emergency department visits, a 52% decrease in inpatient hospital admissions, and a 72% decrease in skilled nursing stays. Overall, a 16% decrease in healthcare costs. Avoiding these high-cost services is one of the most effective ways we can reduce long-term healthcare spending. Missouri itself already has evidence that this approach produces meaningful health improvements and cost avoidance. A Missouri-based FreshRx pilot in the St. Louis region found that by providing healthy food to expecting moms through 60 days after delivery, increased their food security by 44 percentage points, and reduced low birth weight births by 5.3 percentage points compared to the Medicaid average. Based on these results, the program projected approximately $5.3 million in annual Medicaid savings, and that's just in St. Louis City. I also want to point out that those projections measure short-term savings only. They do not include the long-term economic and health benefits of preventing low birth weights or the lasting stability created when families bring home a healthy baby instead of facing trauma and financial strain of preventable complications. Additional Missouri pilot work reinforces the financial impact. BJC's Community Health Improvement Team launched a medically tailored meals program for 182 days and then compared those participants' hospital use before and during the program and found approximately $1,614 saved per patient over that 182-day period. State and national modeling reinforces these findings. Researchers at the Tufts Food as Medicine Institute estimate that produce prescription programs for individuals with diabetes could generate approximately $101 million in net healthcare cost savings in Missouri over the course of 10 years. And after program costs, medically tailored meals annual per patient savings would be $2,362. These results consistently show that nutrition-based interventions can reduce medical utilization by preventing health crises before they occur. At the same time, limited access to healthy food continues to place a measurable burden on the healthcare system. Feeding America estimates that inadequate access to healthy food is associated with nearly $1 billion in avoidable healthcare costs annually in Missouri. That's driven by higher rates of emergency department use, hospitalizations, and complications from diet-related chronic disease. So in practical terms, Missouri is already paying for the consequences of poor access to healthy food through increased medical spending. The bill also supports and strengthens Missouri's agricultural economy by prioritizing the inclusion of community-based organizations and local growers to support the purchase of locally grown food and nutrition prescriptions. This provision helps align healthcare spending with Missouri agriculture by creating stable, consistent markets for locally produced food. Healthcare-backed purchasing supports specialty crop producers, sustains small and mid-sized farms, and encourages investment in aggregation, processing, and distribution infrastructure. Research has shown that locally produced food purchases generate a multiplier effect of $1.32 to $1.90, meaning that every dollar spent on local food can generate additional local economic activity. When healthcare dollars are spent on Missouri-grown food, the benefits extend beyond health outcomes to support farmers, food businesses, and rural communities. Also, in closing, Senate Bill 1075, it's not a permanent expansion of services. It's a structured pilot, evidence-based demonstration designed to test for Missouri, for ourselves, generate our own data, whether prevention-focused nutrition intervention can improve health and reduce costs. For all of these reasons, we strongly urge you to please pass this bill. I will leave my testimony that does have citations in case you want to read them.
Well, thank you for your testimony. Love the stats. Thank you very much. I have no questions.
Okay, thank you.
Anybody else here in support of Senate Bill 1075?
Good morning. Mara Patel on behalf of the American Heart Association, testifying in support of Senate Bill 1075. Because of all the statistics that you've already heard this morning, our organization has created something called Healthcare by Food. And under that initiative, we are really walking alongside states that are implementing food as medicine through the 1115 waiver process. And so even though a lot of the trials are limited in scope, they're showing real promise. So for instance, Massachusetts and North Carolina, they were the first two states to implement through the 1115 waiver process. And both of those states have reported initial trends in reduced emergency department usage and also healthcare costs for participants. So the state already has examples moving forward. We did provide some clarifying language specific to Section 2 to the sponsor, which has already been included in the House Committee substitute, just removing some of the broad language and including medically tailored meals, medically tailored groceries, and a definition for produce prescriptions. And at the end, the American Heart Association, we also launched a technical assistance program, and we hold an MOU with the U.S. Department of Health and Human Services. So if Missouri were to move forward and have an approved waiver, we would actually be the ones supporting the Department of Social Services with implementation and evaluation.
Okay, great. Thank you for your testimony. Any questions for the witness? Sure. Senator Lewis?
Good morning.
Good morning.
I had to step away. It's mostly to the bill sponsor. I wanted to say thank you for bringing this bill forward. Prevention does save money. It helps people. I'm just really grateful, and I'm sorry I had to step away. I wanted to acknowledge my appreciation. Thank you.
Any other questions? Thank you very much for your testimony. We're going to take a quick pause so we can establish a quorum and take roll. So, Mr. Secretary, would you please call the roll?
Senator Nicola.
Here.
Senator Nurnberg. Here. Senator Hudson.
Here.
Senator Carter. Senator Lewis. Quorum is established.
Great, thank you. Anybody else here in support of Senate Bill 1075? Paper, scissors, rock.
I'll try to be quick. Good morning, members of the committee. Tyler Travers, registered lobbyist, here today on behalf of Canby's Markets, which is a food bank headquartered in Senator Lewis's district, but they also serve into Senator Nicola's district as well as Nurnberg, Luke Tameyer, and Washington's districts. Canby's Markets helps to keep about 2 million pounds of food out of the landfill every year by saving pallets that are going to be discarded by wholesalers and then redistributing vegetables and fruits to the communities throughout the Kansas City metro. They also do actively operate a food as medicine program, which is why we were so thrilled to see this bill filed and potentially pilot this in other parts of the state. Canby's Markets partners with University Health in St. Luke's to provide these food prescriptions, and it's been very successful with their patients.
Great. Well, thank you for your testimony. Any questions for the witness? No, seeing none, thank you very much.
Thank you.
Sir, come on up and begin when you're ready.
Good morning.
Good morning.
My name is Billy Polanski. I'm the Executive Director of Columbia Center for Urban Agriculture, and we operate some food as medicine programming in Columbia, and I'm also a part of a statewide group of organizations who are implementing programs like produce prescriptions and nutrition education and medically tailored meals. There's dozens of organizations across the state who are doing these programs already, and so it's a broad array of programs. The bill language, states that to prioritize working with community-based organizations, which is great because there are community organizations across the state that are mobilized and ready to implement programs like this. Right now, that work is happening. It's kind of being propped up by philanthropy, and we're seeing good results. But to really expand and make a big impact, this is a great step forward to getting this across. A lot of these programs that are happening are in the metro areas, and by tying this into Medicaid, we can get programming into some of the rural areas where maybe that philanthropy doesn't reach, or where the tax base isn't present for some of these existing programs in Columbia, St. Louis, Kansas City, Springfield. So this is really going to get across Missouri. Additionally, that inclusion of priority for local farmers is really important too. We're very excited that we can take these Medicaid dollars and get them to Missouri farmers, people who are growing our food and support our economy that way. So we know these programs work. We helped start a produce prescription program with the Columbia Farmers Market. Somebody's here today who will talk about that. But we know that people in these programs, they lose weight, they get off medication, or their diseases are managed better. We've really seen the impact of these programs, and we know they work, and so we support this bill, and Thank you for your time.
Thank you for your testimony. Appreciate it. Any questions for the witness? Seeing none. Thank you very much. Next, in favor of Senate Bill 1075. Just a reminder about witness forms. If you can have those filled out, leave them on the table.
Good morning.
Good morning.
My name is Mary Catherine Crook, and I serve as the Assistant Manager of Columbia Farmers Market in Columbia, Missouri. And I appreciate the opportunity to speak in support of Bill 1075. At our market, we work with farmers from all across mid-Missouri, within 50 miles of our market. So that includes multi-generational family farms, small producers, and beginning farmers who rely on direct-to-consumer sales as an important part of their income. In 2025, Columbia Farmers Market farmers and vendors sold collectively over $4.2 million. In addition to operating a year-round farmers market, we administer SNAP benefits, SNAP and WIC matching programs, and a produce prescription program. Together, these efforts increase purchasing powers for fruits and vegetables while strengthening mid-Missouri agriculture. With multiple food access programs, we at Columbia Farmers Market have a strong administrative framework in place for processing electronic benefits, tracking eligible purchases, reimbursing farmers, and submitting required reports. This is not unique to our market. Farmers markets all across Missouri operate similar programs and have similar frameworks in place, which allows farmers markets like ours to operate programs like our produce prescription with dignity, efficiency, and responsibility. Last year alone, through SNAP, our WIC and SNAP matching programs and produce prescription, we distributed more than $250,000 in food benefits, assisting over 2,100 individuals. Over $85,000 of that was distributed to the over 500 individuals in our produce prescription program, which they then used to buy fresh fruits and vegetables directly with the farmers at our market, making sure that that money went directly into the hands of local mid-Missouri farmers. Our produce prescription program is unique and remarkable in the way that it connects people living at the intersection of chronic illness and low income with fresh, local, nutrient-dense foods, and in the way that it pairs healthcare with local agriculture. The produce prescription program at Columbia Farmers Market is a partnership between ourselves and a local healthcare provider. When a partnering provider identifies a patient with a diet-related chronic condition such as diabetes or hypertension, in addition to a need for increased access to healthy foods, they issue a prescription that the patient then brings to and is filled at the Columbia Farmers Market. When they come to our market, we issue tokens that are spent directly with the farmers, specifically for fresh produce. In many ways, we function like the pharmacist in this model. We've negotiated rates with our funders for administering the service, and we are accustomed to working within structured reimbursement systems. We track each transaction for grant reporting and reimbursement, and reimburse our farmers for those tokens spent. Our healthcare partner reports that the program makes patients excited and more engaged in their healthcare, and that shopping at the farmers market by using this prescription provides a sense of dignity. Participants themselves have shared positive health experiences with the program, including decreased cholesterol, weight loss, being able to afford to purchase the foods recommended by their doctors, and being able to supplement their SNAP benefits enough in order to afford the healthy, nutrient-dense proteins like meat and eggs, which our produce prescription program does not provide. They also spoke of additional and unintended benefits, including more community connection, more time spent outdoors, access to culturally relevant and important foods, and improvements to their mental health. Each one of these shoppers represents reliable revenue for our farmers at our market. One participant in particular shared, for my family, access to fresh fruits and vegetables is not a luxury, it is a necessity. This program has helped us improve our eating habits, reduce food insecurity, and make healthier choices without having to choose between food and other basic needs. Investing in nutrition is an investment in healthier communities, lower healthcare costs, and better outcomes for families like mine. Our challenge at Columbia's Farmers Market is sustainability and scale. Our current program is limited to Boone County residents. It's restricted to one healthcare partner, and it is dependent entirely on grant funding that more often than not runs out before the end of the year. Each year that we've had this program in place, interest in the program consistently exceeds available funding. This bill actively engages in preventative health care while infusing Missouri agriculture with important financial support. It strengthens rural economies, supports family farms, and addresses chronic health issues in a practical, focused way. Thank you for your time and consideration, and I appreciate the committee's thoughtful review of this legislation.
Well, thank you for your testimony. Any questions for the witness? Senator Lewis.
Good morning. I just want to comment on your comment of like food is not a luxury. I couldn't agree more. With the skyrisen costs of groceries and affordability being top of mind issue, this is very timely. I thankfully am fortunate enough that I can absorb some of the costs, but I know not everybody is. So thank you.
Yeah, absolutely. Thank you.
Thank you for your testimony. Appreciate it. Anybody else here in support of Senate Bill 1075? Yes, we do. You guys are making me feel guilty and convicted about all this healthy food.
Yes. All right. Here. Hi there. My name is Lexi Unsman, and I am a registered dietitian with Columbia Center for Urban Agriculture. I support this bill, and I hope you will too. As a registered dietitian, when I was at St. Mary's in St. Louis, my job was to offer nutrition counseling for those who came into the hospital, and I saw many diet-related diseases that came through. One specific patient that I still remember to this day was a 21-year-old male who had been admitted for 2 diabetic comas in 1 month. So as I walked into his room, I asked how things were going, and he just started crying. He had felt so hopeless for what he was doing, and he had asked, mind you, he had already seen a dietitian once before in the hospital, and they had gave him the diabetic handouts, the carb-friendly meals, how to do all those things. But as I tried to counsel him as best as I could, but as I walked out, I was wondering if he would be back for a 3rd time. I truly believe that if a bill was in this place, that his doctor could have seen his A1C rising and prescribed him to have the produce prescription that Mary Catherine talked about, or to give him that money to go get fruits and vegetables, because it's usually easier to add things into your diet. And if he had also offered, like, you know what, you could go to a cooking class and learn how to make a diabetic friendly meal, or what portion sizes really look like. A lot of us struggle with that. And then if he had this amazing meal that had, say a balance of all the nutrients, and they had an offer like Columbia Center for Urban Agriculture where they will offer you a garden that you can grow, then he could be growing his own food like collards or carrots and adding that into his diet. And then a lot of times you have a plethora of food that then you can share with your neighbors. But I truly believe that if this bill was passed and we had preventative medicine, that we could take action right away and give these programs like produce prescription, like cooking classes and gardens, that we would see a huge increase in health in general. And so I'm a big supporter of this bill, and I hope you will be too. And I'm up for any questions you have.
Thank you very much for your testimony. I appreciate it. Any questions for the witness?
Beautiful.
Thank you.
And I would like to say also, I'm a beginning farmer as well. So I have beef cattle, chickens, and also vegetables. So having the support of local farms would also be a huge benefit.
Yeah, thank you very much. Next in support. I can't wait to hear all the ones in opposition. We should eat more chips and cookies and, no, I'm just kidding.
Good morning, Robin Shelp, Director of Policy and Advocacy with Kids Win Missouri. We advocate on issues of child well-being, including child care and early education, health and mental health, and child welfare. Just want to go on record in support of this bill for the reasons said. When parents are feeling better and they're healthy, they can parent better, they can care for their children better. And when parents are eating healthier, chances are children are eating healthier in the home, and this is a generational, has a generational impact. And so for that reason, we support this bill.
Great statements, by the way. Thank you. Any questions? Thank you very much. Anybody else here in support? You got a lot of support, Senator. I see my snacks are starting to get smaller and smaller.
Good morning. My name is Adam Saunders. I'm one of the co-founders of the Columbia Center for Urban Agriculture, also an apple grower up in Boone County. I'm in support of this bill. I think this is good policy. Our organization has been working a lot with MoHealthNet and the managed care organizations to try to figure out how can our hands-on programming complement the medical infrastructure. I want to highlight one particular program that we do called Opportunity Gardens. We do a home garden mentoring program with families living at low income. We go to their house, ask them what they like to eat, help them establish a home garden, and do 3 years of follow-up mentorship. And that is really key to help changing lifestyle habits. It's hard to make changes. But when we go to their house, take interest in their family's health, help them integrate this garden into their diet, it is really a key piece of the puzzle for them to change their health outcomes and their approach, get their kids involved. We could think of health as like having a bundle of sticks. Like what is available in those bundles of sticks to make lifestyle changes, to access healthy food. This program with the 1115 waiver opens up a lot of doors to create more sticks available in our state to help people make those changes. We like the part of the policy that partners with local farmers and local organizations. That is a key piece of the puzzle, and we would love to be able to expand this home garden mentoring program beyond Boone County, which is where our funding is rooted from, but with a statewide model. This can really help folks take these steps into their own hands, get their kids involved, get grandparents involved, and really help them transform their lives.
That's great. Thank you very much. Any questions for the witness?
Thank you.
Seeing none, thank you very much. Did you, I forgot, did you bring a witness form? Did you have, okay, perfect. Next in support? Nearly the whole room, Senator.
Mr. Chair, members of the committee, Matt Thompson here on behalf of BJC Healthcare and Feeding Missouri to express our support for Senate Bill 1075. The sponsor did a great job explaining how food impacts healthcare outcomes. Others spoke to the studies that have been done by BJC Health and Feeding America on those impacts, so I won't belabor the point, but glad to express our support and happy to answer any questions.
Thank you very much. Any questions for the witness? Thank you. Anyone else here in support of Senate Bill 1075? This is where I'm really excited. Anyone here in opposition to Senate Bill 1075? That's what I figured. Anybody here for informational purposes only? Seeing none, Senator, any closing remarks?
Just say thank you for the time, Mr. Chair. Appreciate
Absolutely. Thank you very much. This concludes the hearing on Senate Bill 1075. Next, we will be hearing House Committee Sub for House Bill 2273, 1946, 1814, 2551. Representative Lewis, begin whenever you're ready.
Thank you, Chair. Thank you, Committee, for those of you who are here, and appreciate you hearing this bill. I am Representative Ed Lewis from Randolph and Macon County. The bill that you have before you is the House Committee substitute for House Bill 2273, 1946, 1814, and 2551. The bill you're hearing today is a comprehensive bill relating to our state's anti-trafficking efforts for minors, including provisions about grooming and sextortion, also mainly for minors, and the training that is necessary to combat these attacks on some of our most vulnerable persons in our society. The bill includes the gentleman from Warren's from 1946 provisions about trafficking training and awareness. The gentleman from Polk's bill, which would be 1814 on grooming. The gentleman from Christian's bill on sextortion, 2551. This bill came through committee this year through Children and Family 12-0 and the legislative review unanimously. I want to remind you that we also voted the majority of this bill through this body last year in the House 151 to 3, and also through the Senate, and was within 15 minutes of being finally passed when the Senate closed. Fiscal Review voted unanimously and was voted out of the House this year, 148 to a misguided 2. This bill has its origins from a council created by statute that I chaired for 18 months that ended in December of 2023. The bill is largely a bill, it's a fairly large bill of 76 pages, but much of that is caused by a wording change about child pornography, changing the word child pornography to child sexual abuse material, which is what it is. A child cannot consent to sexual acts with an adult or for the production of sexually explicit material. It is a wording change that's not just symbolic, but is important for the understanding of the crime. Pornography implies consent, and therefore child pornography is CSAM, child sexual abuse material, not child pornography. Since this occurs 58 times in statute, we have to touch the statute in many pages, hence making this a relatively large bill. The first time that occurs, if you're looking at the bill, is on page 2, line 7, and on page 5, lines 44 through 45, 44 through 45, the accompanying language that makes that offense stackable. And this occurs, as I said, almost 60 times in statute. So every time we change it, it makes the bill a little bit longer. That is one piece that I mention it first because it's one of the reasons that the bill is long, but it also is it's the first occurrence that you see in the statute of where we're actually changing statute. One of the very important and crucial parts of the bill is on page 15. This will establish the Attorney General's statewide counsel against adult trafficking and commercial sexual exploitation of children in section 210.1505. This would be a reinstatement of the council that I chaired and that I mentioned earlier, and which was created in the 101st General Assembly. This council is important as it links the government's efforts to curtail sex trafficking, especially for minors, and to connect our response with DSS, with juvenile, with highway patrol, and with law enforcement, and also with the CACs and those other direct support agencies and NGOs, non-government organizations, who help those who are trafficked. Without that connection, without the Attorney General office connecting those together, I don't think that our efforts will be as effective. This reinstated council will now be housed in the Attorney General's office and will not have a sunset provision. If I continue through the bill, and I'm actually going through the bill chronologically, page by page, on page 17 of the bill, the new executive director of the Human Trafficking Council inside the Attorney General's office would be created as the director inside the Attorney General's office, and traffic for that funding has already been in the budget last year, and that money is also there is money in the budget this year, and both of those I've been assured are going to stay put, and that funding will be more than enough for the executive director position and the things that they're going to be doing in the next year. Page 18 deals with the fund created because there's a specific fund. It stays put. Money in that fund does not revert back to General Assembly. Page 19 outlines the subcommittee within the statewide council that will work on developing the training protocols and information for all the interested parties, law enforcement, EMT, teachers, lodging owners. There is not a reason to have training created and recreated by multiple different agencies when one location can serve as the hub to make sure that the training is organized and is telling the same message to all interested parties. Obviously, what law enforcement might need might look different than what some EMTs might need, or what would look different to people in DSS or in juvenile. But the same information needs to be presented, and that will be housed inside a subcommittee inside the Attorney General statewide council. Page 33 of the book, section 530C of the bill, page 537.054, deals with the statute of limitations of sex trafficking and CSAM offenses and extends them from 10 years to 20 years for civil offenses, and that would be if once someone was 10 years, or once they were turned 21, they'd only have 10 years if they were a minor, so they would only be 31 before they could bring that. Sometimes people don't even realize what they've undergone before that, so we've doubled the time to 20 years to make it, they would be all the way up to 41 when they could still bring a cause with, for a civil offense in that arena. Page 43 and 44 is the grooming bill. It says that a person 21 years old who uses their position and pattern of conduct to prepare a student 17 and under for sexual exploitation can be prosecuted for grooming, and the grooming of a minor would be a Class C felony. If it results in sexual contact, it could be a Class B felony. This is called Evie and Sophie's Law, I'm sorry, and it was brought because of the grooming that occurred by a Taekwondo instructor, and the individuals, the young girls that were in that, they received thousands of text messages trying to isolate them from their parents and trying to get these children to run away or to have a relationship with the definitely over 21-year-old Taekwondo instructor, and wasn't prosecuted because the actual sexual contact hadn't occurred. And for me, this is, I'm sure there'll be someone who talks about this behind me, but these are just an example of the type of things that we need to be able to intervene before something occurs, right? Not after something occurs. The next section on page 45 explicitly states that the AG of Missouri can assist in CSEC cases in Missouri, child sexual exploitation cases, and will help with the prosecutors and circuit attorneys. The next part of it, Evan's Voice Act, is the sextortion piece. And I'm sure there's someone behind it will talk about that, but Evan was a young man who committed suicide when he was extorted and coerced with a sexual picture. We know that those type of things lead to sexual exploitation, commercial sexual exploitation, or trafficking, and the offense for that is a Class D minor and a Class D felony. A Class D, and if it's a minor, a Class C felony. In sextortion, section 571.112 and 573.114. Page 57 deals with some restitution pieces. Page 65 threatens, if they're using threatening language for sextortion, puts that on a sex register as a Tier 2 sex registry offense. There are different locations in the bill talking about requirements. On page 68, it talks about requirements for post-training. And page 72 deals with the Crime Victims Fund, where these funds, that's already exist in federal statute, and we already fund this in state law without a statutory requirement. This is a thing that probably just needs to be put into there for statutory purposes. And then the last, on page 72, it has a piece about the expungement of a person who has been trafficked. If a person's been trafficked and they are arrested for prostitution, that they could seek expungement because they were coerced, they're the victim, and they're not they're really not the person that we should have incarcerated or prosecuted for prostitution. So with that, I know that's a lot of information. I feel it's my duty when I come to the Senate and present bills. I find that I want to point out every aspect of the bill, so there's no hidden. I mean, I've covered every last piece that's in the bill. As far as I know, I don't think I've left anything out. But this is something, Missouri right now is ranked 4th in the state in state sexual trafficking. That's not a distinction that we want to keep. Our efforts will be enhanced by the things that are in here. The things that are in here will enhance our efforts to combat that, and whether it be on grooming or on sextortion or on pornography, child pornography, or whether it be with the training that's going to occur inside the statewide council. And to me, the most important thing is establishing the statewide council in the Attorney General's office to make sure that there is a concentrated statewide effort that continues regardless on who's sitting in what office and where. And with that, I would open myself up for questions.
Thank you so much, Representative, for bringing this forward and for your hard work on this issue. Sex trafficking, child pornography, such an atrocity in our culture, and it's growing so rapidly. It's unbelievable, and we need to do whatever we can to protect our kids. And I appreciate your work on this. I've got all kinds of questions, but quite honestly, I didn't get this bill till yesterday afternoon, so I haven't had time to really go over it, but listen to what you had to say. I will do that, and if I have any questions or things we'd like to talk to you about, I'll get with
Absolutely,
you on that.
I'll be available.
Yeah, thank you very
And
much.
the other sponsors are here as well, and if you had a question, they'd be glad to
Yeah,
talk to you about it.
thank you very much. Any
bet.
questions for sponsor? Senator Lewis.
Good morning, Representative Lewis.
Good morning, Senator Lewis.
I don't miss the Lewis mix-up.
Yeah,
you
we were
know.
always on the committee together.
Yeah.
And they got us alphabetically wrong on a couple of committees, so we
Yeah.
never know whether we were supposed to answer or not.
And I hear we're getting each other's mail still, but anyway,
If it's checks, make sure you send it my way, okay?
Okay, sure.
Okay.
I'm pretty familiar with this. I heard about this. My representative, Patty Manser, had told me this was in the making. Just wanted to share with you that during the interim, my representative, I were working with our constituents who human trafficking, a group of them, it was a huge issue and they wanted to address it. We were looking at things and then we saw that this was in the works. So I'm just really excited to see this come before the committee I serve on, and excited to report back to my constituent that this is, come before me.
It's an exciting thing that this is the first, I believe it's the first House bill being heard. If it's not, it's in the top 3 or 4 House bills being heard on this side.
Mhm.
And it was the third bill voted across the floor on the House side this year. And so I think that shows the priorities both of the Senate and of the House to move something that is bipartisan, that is really addressing some of the real issues that we face in Missouri, and will help the most vulnerable. So I appreciate you also working on this.
Yep, and I think it's a testament of when, there's things we aren't going to agree on, but when we work on things that we agree on that really help people, it's really benefits all of our constituents. And I appreciate you going through it line by line, page by page. That will save me some time on the floor.
Yeah, you're welcome.
Well, thank you very much. Have you guys ever considered the Lewis and Lewis show? I'm just curious. Just the thought that came to me.
We haven't, I don't think.
Okay. Anyone here in support of this House bill that's got 44 different numbers to it?
Good morning. My name's Brad Bettler. I'm representing my wife and my son, Evan James Bettler, and on behalf of our nonprofit, Evan's Voice. Our son was a fantastic student, a fantastic kid, model in the community, model in the school, was a leader in several organizations throughout the school, was a leader on the soccer field as well. I loved the outdoors, and in general was just a fantastic young man. In January, my wife and I returned from work. We're both educators, trying to start off a new year strong. We took 2 laps around our subdivision. When we approached the end of our driveway, we got a text message from our son, and that was followed by an unmistakable sound that he had taken his own life. For the next month, my wife and I were really sent reeling because we had no idea why. The cops took his phone, searched through his phone. There was nothing found there. He was healthy. He was strong. He had no issues at school, no family issues. Just a good kid, and everybody was reeling. Our community, the people at school, were trying to figure out, did they miss something? A month later, in February, a message thread appeared on his phone, and my wife was continually checking his phone because her mom heart said something wasn't right. A message thread just appeared on his phone out of nowhere that wasn't there before. The cops confirmed that they had checked the app, and it wasn't there as well. It had one picture, and then it followed with a message that said, "I have your photo. Are you ready to comply, or I'm going to ruin your life?" It was followed by hours of messages trying to get him to submit his bank card, our account information, send debit card information, all kinds of different ways to try to extort him. And it was over one picture. And he truly thought that his life was ruined. For the next month, we kind of kept that information to ourselves. Just my wife and I and our police chief were the only ones aware of it. Our community was still really reeling, trying to figure out. Our family was even reeling, trying to figure out, what had happened, why Evan had made this, choice. And so in March, we chose to go public with the information. We did a press release, and within 10 or 15 minutes of the press release, we started getting messages from people in our community saying, hey, that happened to my son. Hey, that happened to my son. Unfortunately, they had not spoke up about it. So we as parents were unaware that this was even something that was going on. Since that time, we have learned that it happens more frequently than anyone could ever imagine. I could quote statistics and data all day long. It's been identified as the fastest growing crime impacting kids by FBI, by NCMEC, by Thorn, by Secret Service. It's impacting our kids and our communities and our schools at a rate that is just astronomical to even fathom. My wife and I actually worked with two families on Monday evening that were in the middle of sextortion events or situations with kids or young people. To have this bill and make this a crime allows our police departments to really take a more active piece in being able to address it. It also, it's just going to protect our kids, which I think everybody can agree on that our kids are definitely a precious resource and need all the support and protection that we can give them. So I highly support this, and I appreciate all the representatives for really stepping forward and bringing this to fruition.
Sir, thank you so much for coming and sharing your personal story with us. And I cannot express to you the sorrow, and I can't imagine what you and your wife have been going through. And I pray that God bless you and continue to keep you and give you a spirit of peace through all of this. But thank you. This is this whole issue is just unbelievable. And now with the fast advancing of AI and the potential that AI has to even cause more harm is just absolutely incredible. And we've got to do, as a state legislature, we've got to do whatever we can to help protect our kids. So thank you again for sharing your personal story. I really appreciate it. Yeah, Senator Lewis.
Good morning. I just echo the chair's comments, and I know it's not easy coming to Jefferson City and testifying before a committee on any issue, and when it's personal and expressing your loss. I'm sure this isn't easy, but it does make a difference, and I'm sorry for your loss, but thank you for being here.
Thank you. Thank you. Our goal is just to protect kids and to agree with the fact that the AI and the advancement of technology is impacting, and it's going to make it even more important to have things in place to protect our kids. I've heard from families that it's already taking place, and there's a case just southwest of us where a kid had 5,000 images on his phone involving, I think it was 11 students, and it was just taking their headshots and putting them on inappropriate bodies. And unfortunately, this is something that's happening in the hallways between students in the same schools as well, which is extremely frightening.
Yeah.
And disappointing.
I'd like to talk to you too, if you don't mind. Do you have to run out when this is over?
No.
Yeah, I'd like to talk to you if you don't mind.
Okay.
Yeah. Thank you again for your testimony.
Thank you, guys.
Next, in support of House Bill 2273, 1946, 1814, and 2551.
Good morning. My name is Timothy Faber. I'm with Issachar LLC, and I'm not good at numbers, but I support all this. So thank you for allowing me to speak on this bill this morning. I love the fact that we're getting more serious about this issue. There's two things I would like to see addressed in the future. If I understand it right, there's a sunset clause on these trainings, annual trainings. December 31st of 2031 or something like that. Why is that even there? It only serves to guarantee that this will come up again in 3 to 5 years and reconsider whether to continue it or drop it. To me, that seems like a waste of time and money. If you all aren't sure that a law ought to be passed, then don't pass it. But don't go hedging your passage with doubt and indecision by putting in sunset clauses. If, for whatever reason, the bill needs to be repealed in the future, have the guts to stand up and file for its repeal. But if you truly believe that it ought to be passed, then pass it without the sunset. Second, in 566.152, I don't believe the penalties are serious enough. These ought to be Class B and Class A felonies, not Class C and Class B felonies. After all, there's only 3 ways to deal with these perverts. 1, God could get a hold of them and transform them. But God's not a bully and will not force them to do that. They have to agree to allow him to change them. 2, since the Lord has given civil government the responsibility of punishing evil, we could exercise capital punishment on such offenders and eliminate the problem from our midst. 3, since some are uncomfortable with option 2, we can pass laws such as this that provide for better education and training and stricter consequences than we currently have. In case you haven't figured it out yet, my position is that this is a good step in the right direction, but I don't think it goes far enough. However, since it came from the House, you have to either pass it as is or get the House to agree to any changes. Therefore, if you're confident that you can get the House to agree to the changes I suggest, then do so. I'd rather see it passed as is and the penalties stiffened at a future time than to see it fail now. So, either pass it as it is or get a sense of the House's concurrence to removing the sunset and stiffening the penalties and pass it with those changes. Thank you.
Thank you very much for your testimony. Any questions for the witness? Seeing none, I appreciate it. Thank you. Next, in support of House Bills.
Good morning, committee. My name is Madison Royer. I'm with a grassroots efforts called Missourians for Child Protection to strengthen laws protecting children in Missouri from sexual abuse. I support this bill in its entirety, and I've gotten to know a lot of the people who have had parts and different pieces of this bill, and they are victims. So this bill, it has names and it has faces, it has victims behind it. Some of those victims are Evelyn and Sophia. Evie and Sophie's Law is named after them, and they are my 2 teen sisters who were sexually groomed by their Taekwondo teacher. And he was trying to convince them to run away with him. He was professing his love to them. And he had been grooming them and trying to divide them from their family and isolate them, and he would love bomb them, and then he would humiliate them, and he would have incredibly sexually inappropriate conversations with them. He would, as part of training, he would have private lessons with them, and he would give handcuffs and tell them to handcuff him and yell at him, and he would say, "Oh, that's doing something to my loins." So it was awful. But what I found out through all of this is that the only law we have that would address this behavior is enticement. But what happens in case law with enticement is that the only time typically someone is prosecuted for enticement is if they had texted the child explicitly asking for sex or they have raped the child. Lots of states have enticement laws. So what they're doing to address this issue is they are introducing grooming laws. Ohio, Texas, Illinois already have grooming laws with great success. And then Kentucky, someone from Kentucky, a legislator from Kentucky, actually came to our House hearing, saw our grooming bill and said, "I want that in Kentucky." So in Oklahoma, currently they have an anti-grooming bill in the Senate. Lots of states are getting rid of their enticement laws in favor of grooming laws because the research has been updated. And what we have found is that sexual grooming is present in 99% of child sexual abuse cases. Grooming is the tool that predators use to ensure compliance and prevent disclosure. Elizabeth Jeglick, PhD from the John Jay College of Criminal Justice, has done a lot of the leading research on sexual grooming. And what they have found is that it is a predictable pattern of behavior. They have broken down those patterns into stages. They have identified those behaviors into red flag behaviors. So this is not a hypothetical, hard to understand thing. It has been highly researched and it is identifiable. And this law addresses this. In states like Ohio, where they have anti-grooming laws, they have seen prosecution rates go up significantly into child sexual abuse cases directly because of their anti-grooming laws. They have also seen investigations go up significantly because of their anti-grooming laws. They have seen more investigations, which have led to the discovery of trafficking, sexual abuse, and child sexual abuse material. The average age that people go into prostitution is 15 years old. Most people who go into prostitution, the first time they go in, they're a minor. And grooming is the tool that these pimps, these predators use to traffic these girls, to traffic these boys, and to keep them complicit. So I support this bill in its entirety, and I hope you all do too. Thank you.
Thank you very much, and I appreciate the advocacy that you're doing, sharing your personal stories. And I know you and your sister came into my office a few weeks ago, and it was just a pleasure to get to meet both of you. So thank you.
Yeah, thank
Keep
you.
it up, too.
Thank you.
Yeah.
That was a pleasure. We're still reminiscing. It was beautiful.
That's great.
Yeah.
Any questions for the witness? Seeing none. Thank you again.
Thank you.
Really appreciate it. Next in support.
Good morning, Mr. Chair, members of the committee. Dan Ingeman, Director of Policy for the Attorney General's Office. Wow, there's not a lot that I can say that's going to, top that, unfortunately. But appreciate, Representative and the great work in the House to this point to bring this bill here, and the witnesses that are here today and they're sharing their testimony, how courageous they are. But what I wanted to leave you with this is that to make sure the committee knows the Attorney General's Office is a strong supporter of this bill. We've worked with the sponsors for a few years on different pieces of anti-human trafficking legislation. And from day one, I'm sure you've heard her say, General Hanaway has made it clear that fighting violent crime is her top priority. And so these efforts, anti-human trafficking efforts, play a key role in executing and delivering on this priority for Missourians. Representative Lewis had mentioned the statewide council against adult trafficking and commercial sexual exploitation of children. So we stand ready to lead that in our office. We will appoint an executive director as the bill requires. And this executive director will work alongside our current anti-human trafficking director of operations. We also stand ready to chair the Committee on Sex and Human Trafficking Training as the bill outlines. So the bottom line is this committee fits well and formalizes what the Attorney General's Office is already doing. Happy to take any questions or provide any further detail on the important work that we're doing on this topic.
Well, thank you, Dan. I appreciate it. Thank you for your testimony. Any questions for the site?
Thank you.
You bet. Next in favor.
Good morning.
Good morning.
My name is Jessica Hill, and I'm the Chief Public Affairs Officer for the Missouri Coalition Against Domestic and Sexual Violence. While we are in support of all the various aspects of these bills, my testimony today will focus on the establishment of the Missouri Crime Victims Fund within the Department of Social Services. That's on page 72 of our 76-page bill. The Victims of Crime Act, or VOCA, signed into law by President Ronald Reagan in 1984, established the Federal Crime Victims Fund as a non-taxpayer-supported resource financed through federal fines, penalties, and forfeitures. In recent years, declines in prosecutions and uncollected penalties have led to critically low balances, reducing federal support to states. In Missouri, the General Assembly has supported the work of victim advocates serving crime victims that include child victims of physical and sexual abuse, families affected by drunk drivers, and survivors of stalking and rape, to name a few. However, the 2027 proposed budget eliminates that support, creating a projected $15 million shortfall and potentially cutting available funding by 50%. Without action, the consequences for Missouri crime victims will be severe. Providers have already endured funding reductions this year, and additional cuts of up to 50% could leave an estimated 140,000 victims without services. Because as much as 80% of VOCA funding supports essential personnel, these reductions would destabilize the very workforce that guides survivors through crisis intervention, emergency shelter, child advocacy centers, court-appointed special advocates, prosecutor-based advocates, and many more supportive services. Rural communities would be particularly hard hit, and the broader criminal justice system would suffer as advocates play a critical role in helping victims navigate the path toward long-term safety, healing, and participation in the justice system. Missouri's crime victims need these vital services, and the obligation is not solely on the federal government to financially support these services. Creating the Missouri Crime Victims Fund, using the current framework of the VOCA program within the Department of Social Services, offers a sustainable solution for future appropriations to support the existing work of victim service providers. Most importantly, it guarantees that support for victims remains stable and dependable, sending a clear message that Missouri stands with survivors and is committed to preserving their dignity, safety, and access to justice. Thank you for your consideration of this important legislation.
Thank you very much for your testimony.
Thank you.
Any questions for the witness? Seeing none, thank you very much. Next in favor.
Hi, good morning. I'm Jessica Seitz. I'm the Executive Director of Missouri Network Against Child Abuse. Our organization supports very many parts. As you know, there's many things in this bill, so I'll just touch on kind of the high level. For the trafficking components, we have been working with Representative Lewis for several sessions to get these over the finish line. It's been kind of a Herculean effort, but there's two pieces that I really want to emphasize are important. The first are, the 60 pages of the 70 changing the language from child pornography in our criminal code to child sexual abuse material. It is language matters. That is what this material is. Pornography implies some kind of consent. Mm-hmm. And so just changing the language to clarify is really important. Similar language is being pursued at the federal level as well. So just get our criminal code up to date. Also, the renewal of the statewide council that was referred to by the Attorney General's office, very important. We served on that a few years ago before it sunset. It was really great work, but we realized when it sunset there was so much more to do. And so it's not just another task force. It is, we've got somebody standing ready to hold it, chair it, and get us all together. So I encourage, that to be put into statute. So, the grooming components, I know they've already been touched on, and someone from the Prosecutors Association is here to clarify that, but we're happy to see that addressed. The enticement was mentioned. I do think we might need to look at both of our criminal around enticement and grooming, ensure they're not duplicative, maybe combine. But I'll let the prosecutors speak to that because I'm not a lawyer. And then I want to thank the family here who spoke about sextortion. That is the part in the bill that refers to the non-consensual dissemination of sexual images. That issue is very, very increasing in prevalence. And it was something, honestly, even though I work in this field, I was not as familiar with until I attended a conference at the National Center of Missing and Exploited Children this summer. And it was horrific. This is national. Something is being pursued federally there as well. And I'm really happy to see that Missouri, is stepping up right now. And so I want to thank the families for their bravery in sharing their stories. And then finally, just to echo my colleague who came before me, we're happy with the establishment of the Crime Victims Fund. I see that a little bit as kind of belt and suspenders. It doesn't have money attached to it, but it would allow appropriators, if resources are available, to kind of help, because Victims of Crime Act funding is essential. I represent child advocacy centers, and all 15 of my regional centers receive VOCA, and so and it's a critical source of funding. So there's my bit.
Well, thank you very much for your testimony. And I don't see that I have any questions, so seeing none. Next in favor.
Good morning,
committee member.
Good morning.
My name is Locke Thompson. I am here for the Prosecutors Association. We are very much in support of this collection of bills. There are a couple things, maybe some friendly suggestions that we might have. I know that we're due to speak with some of the bill sponsors a little later. Just regarding the enticement language that currently exists in Missouri and sort of making sure that there's not too much overlap with any grooming language or possibly rolling grooming language into the enticement language, because they are very, very similar when you look at the grooming that's proposed versus the enticement that already exists in Missouri law. One thing that caught my attention, one of the gentlemen who was previously testifying was talking about how he didn't think that the punishments were severe enough, or that the classifications of felonies weren't high enough, and I would tend to agree with that. And I went back and looked. Our enticement statute used to be where it was a minimum of 5 years up to 30, and that got changed last year to where now it is a Class C felony or a Class B felony with an enhancement. So I honestly wouldn't hate to see it go back to what it was before. I know I've prosecuted a number of enticement cases in my career, and judges usually take those things pretty seriously. I think the last one I did, the guy ended up getting 15 years in prison on that one. There's one other piece of the enticement language I think we would like to see taken out, and that is the carve-out that is there for the parents or guardians if there is no evidence of or family member who is providing standard care if there is no evidence of sexual intent or exploitation by that person. If there's no evidence of sexual intent or sexual exploitation by someone, then they can't be found guilty of this offense in the first place. And in my experience as a prosecutor over a decade now, the sad reality is the most likely individuals to commit offenses against children are family members and occasionally sometimes parents or guardians of those children. So I think we would like to see that carve-out come out as well. I do want to echo what the previous witness said about the importance of changing the terminology from child pornography to child sexual abuse material. I've prosecuted a lot of cases where you have child victims and they go through a lot of emotions as they're going through the court process. It's a scary thing. It's a for the most part for them, an entirely brand new experience, and a lot of kids feel some sense of, and a lot of times it's because of the person who's been abusing them or grooming them. They feel like, oh, this is somehow my fault that I'm here, and this is on me. And no kid should ever feel that way, and I do think that changing that language, while it might seem like a subtle thing, is a really big thing in helping children understand that they are not at fault for what has happened to them. Finally, I would like to mention, again, the VOCA funding piece that's been included in this legislation. I think could be very helpful. The prosecutors' Office of Prosecution Services is due to receive a 33% cut in our VOCA funding statewide, and that is going to entirely eliminate a number of victim advocate positions that we have around the state, which will be obviously a huge detriment to our prosecutors' offices and to those victims that we serve. That I'm happy to answer any questions.
Yeah, thank you very much for your testimony. Any questions for the witness? Seeing none, thank you, sir, very much. Next in favor.
Good morning, Chair and Committee. My name is David Barnes. I'm here representing the Missouri Emergency Nurses Association, and we're in support of this bill. My organization and the members that I work with see this and have seen this situation of human trafficking, child abuse, domestic abuse. We live with this day to day, 24/7. Human trafficking is a scourge that is global. We're the state organization of a national organization as part of an international organization. We cover, I think there's now 26 countries involved besides the U.S. dealing with this. And to share a couple of statistics on this, it's modern day slavery, actually, when you're talking about human trafficking on that. In 2016, estimated 40.3 million people were trafficked global-wide. 1 in 4 of those were children. And it addresses to me and my heart, listening to the stories I already heard about this, as far as trafficking, anything you're talking about that it goes against our kids gets to me very quickly on that. Just to give a little dollar figure to this, globally estimated that the revenue from human trafficking as high as $150 billion in U.S. dollars in 2016. This is a big moneymaker for some people who don't really care about humanity as a whole on that. Emergency nurses are in a unique opportunity to recognize human trafficking and intervene on behalf of the victims of human trafficking. In fact, nurses may often be the only individuals in positions of trust who can connect with the trafficking victims. The first person that may see someone that doesn't live in the gray area of law enforcement and that they feel they can share their experience with. But identifying these patients, lots of times they don't see themselves even as victims on that. And it's a really challenge for us sometimes to take time to go through the screening process to see who they are. We have spent years of training on this. I was discussing this with a member of the Louisiana State Nurses Association who is an educator, and he said, let me send you our online training for human trafficking. I have multiple resources I'm gathering available for both nationwide and in-state to provide the training for people for this. We're kind of late to the game. I realize this bill has been going through here a long time, and our association usually sits on the sideline and stays quiet. I decided we couldn't do that this year, and that we needed to be involved to be sure that there is a pattern of language being the same all the way through from law enforcement, from EMS to our nursing, especially our SANE nurses who are probably going to be at the turning point. We're dealing especially with sex trafficking, on through to our prosecutors and the Attorney General's office, that we're speaking the same language, that the custody of evidence doesn't get broken along the way. There's so many things in here. We would like to bring our wealth of training already and educating, along with the resources we've already developed. I have a couple I can share with you. The red flags that we use, some 18 of them we look for when we see a person we think may fit into this category. And we just appreciate the opportunity to speak in favor of this. And we're behind trying to make this work, not just to be talking about it here at a table. Thank you.
Absolutely. Thank you. I appreciate it very much. Any questions for the witness? Seeing none. Thank you, sir. Next in support.
Good morning, Robin Shelp, Director of Policy and Advocacy with Kids Win Missouri. I don't really have anything to add. I think everyone has said a lot. We've done a lot of bills this year related to keeping children safe with AI and social media, and I think this just fits nicely with the grooming piece. We need to address that aspect of keeping our kids safe. And of course, the sexual trafficking, I thank the sponsors for the continued work on this.
Yeah, thank you very much for your testimony. Any questions? Seeing none. Next in support.
Mr. Chair and Committee, Michael Henderson for the American Hotel and Lodging Association. Support the bill, especially the sections on human trafficking training for employees of lodging associations. Want to thank the sponsor, other representatives, and the senators who have filed companion language on these issues over here. Happy to answer any questions.
Thank you very much for your testimony.
Thank you.
Any questions for the witness? Seeing none, thank you.
you.
Any others here in support of the House bill? Seeing none. Any in opposition? Anyone here for informational purposes only? Perfect. Representative, any closing remarks?
You know, I do appreciate all the people I appreciate you all being here, but also the people that have come to testify. The one question, the questions around the grooming and the enticement piece, I know that we have been working on with Senator Carter, and, if there's a small change, we will get this. If it has to be changed and come back to the House, we will get it passed. It will not be a problem to advance this in the House. It was 148 to 2 misguided. And so we know that we can get this passed if, we need to tweak something. We're not telling you have to pass exactly what we have, but it also has been really well vetted. I do appreciate the EMT Nurse Association. They said, we want to be included. We're not included right now in the training subcommittee. Can you put us on there? Absolutely. So they are in that piece, and I appreciate that. We've got to stop this modern day type of slavery, and we need to carry this bill. I think it should be the first bill out of the Senate to come back to us, or the first bill passed as is, and the first one that we actually third read and finally passed, and that's the governor's signature. So I appreciate your hearing us today.
Well, thank you very much, Representative. Thanks again for all your work, hard work on this.
Thank you.
On this legislation. So this now concludes the hearing on House Bill 2273, 1946, 1814, 2551. I make a motion to adjourn. Do I get a second? We are adjourned.